Let's talk about hip internal rotation. This one's sometimes also called medial rotation, and it occurs when the femur rotates toward the midline of the body. It also occurs in standing when the limbs are fixed and the pelvis rotates. A normal value of internal hip rotation is about 45 degrees, although few individuals get anywhere near that level of movement. And a minimum of 35 degrees is considered sufficient for most people. Many people are aware of the need. A lack of extension can cause big problems for sports people and non-sports people alike. One large issue is the link between reduced hip extension and gluteal muscle inhibition. Inactive glutes increase the strain on the hamstrings and the lumbar spine, to name just a few of the knockoff effects. However, what a lot of people don't know is that in order to sufficiently extend the hip toward the end of the gait cycle, there has to be enough hip internal rotation. Without sufficient internal rotation, the hip cannot move as far forward and we instinctively shorten our stride. In fact, without full internal hip rotation, the body employs various compensatory techniques to get by. In the end, these cause problems of their own that inevitably, somewhere along the chain, lead to injury. The most common compensations seen in those with a hip internal rotation deficit include overpronation of the feet, a knee valgus, reduced step length, external rotation of the foot, and increased lumbar and knee extension. As you can imagine, such varied compensations can result in numerous injuries, from the ankle to the shoulder. Where a hip internal rotation deficit becomes even more troublesome is in those sports and activities that require deep hip flexion, like squatting, or rotation through the hip, lumbar spine, and thoracic spine in particular. Golf is a great example. In order to increase the range of motion in a joint, you need to focus on reducing muscle tension in the opposing muscle group, in this case the external rotators, as well as strengthening the internal rotators themselves. Here are a couple of stretches and ways to strengthen your hip internal rotation. Start laying flat on the back with both knees bent and feet on the floor. Take the feet wide, wider than the hips, and then allow the knees to fall inwards toward each other, thus internally rotating the hip. Hold this for 30 seconds and breathe. Relax your shoulders and repeat 2 to 3 times. Again, lying on the back, grasp the knee with both hands and pull it across the body in the direction of the opposite armpit. If this feels tight on the inside of the hip, you can also grab your foot, pull it towards you to stretch the outer hip. Hold this one for 30 seconds per side and repeat 2 to 3 times. These can be practiced 2 to 3 times per day in the beginning and then progress to a couple of times per week for maintenance. Start on the floor and separate your bent legs in 90-degree angles. The front leg is in external rotation, the back leg in internal rotation. Lift the back leg up. Stay as upright as possible and lift the knee up toward your shoulder. Then actively return the back leg back to the floor. Go for 2 to 3 sets of 8 to 10 controlled repetitions. Always work both sides evenly to avoid imbalances. Sit upright on a chair or stool. Place a block between your knees and a short resistance band around your feet. Now push the feet out to the sides and hold. Feel your hips engage. Go for 2 to 3 sets of 8 to 10 repetitions of 10-second holds. There you have it. Hip internal rotation deficits are much more common than you think and can set off a large chain of dysfunctions which can result in pain and injuries and performance deficits. So if you don't already, check your hip internal rotation.